Ms. Zackelhawk.
Good morning, and I want to thank you, Madam Chair and Ranking Member Joyce, and also acknowledge Representative Kilmer, who has had such strong support of our organization in Washington, both our urban Indians and our tribes. Thank you for this opportunity to speak with you. My name is Abigail Echohawk. I'm a citizen of the Pawnee Nation of Oklahoma, and I am the Chief Research Officer at the Seattle Indian Health Board. In that role, I direct the Urban Indian Health Institute, which is one of 12 tribal epidemiology centers located across the United States. The tribal epidemiology centers are tasked with ensuring that the health needs and the health resiliencies of American Indians and Alaska Natives are represented through evaluation, data collection, and research. This was an effort that was driven by tribal leadership, and we are directed by tribal leaders for our tribal nations. We fulfill a very unique need here in the country because often when we talk about research and data, what we hear is that we don't have data. This information does exist. All you have is a few individual stories, but we need the data in order to make these informed decisions. It is our role to ensure that our tribal communities and our urban Indian communities have this information. However, we are woefully underfunded. And in fact, I am directed to use the $341 approximately that is given across all of the 12 tribal epidemiology centers to cover more than 70% of the population. And that's because the Urban Indian Health Institute represents the needs of all urban Indians living across the country. I specifically serve the organizations that Maureen represents, along with more than 20 others that provide social services, elder care, diabetes care, and youth services of more than 62 organizations in 28 states and more than 130 different counties across the United States with less than $400,000. What does this mean? When we talk about evidence-based practices and the practices that we are supposed to implement within our tribal clinics, the evidence that is gathered for these practices don't actually represent us. So when research is done, American Indians and Alaska Natives are very rarely included. So practices that we're supposed to do in diabetes management, in preventing cancer, in obesity, those practices actually don't have our evidence in them. And if they were going to work, they would have worked by now. So we are forcing these interventions that were never meant for our people, yet that's what we're being asked by the government and the states and our counties to implement with our people. That is the reason organizations like the Urban Indian Health Institute and the Tribal Epidemiology Centers are so important to the work that we do. We answer to the needs of our community, and very often we do that underfunded. I want to share with you two particular things that we've been doing at the Urban Indian Health Institute, one on sexual violence. We released a report in Seattle that talked to 148 Native women living in that city who had been affected by sexual violence, and what we found was a 94% victimization rate. That means 94% of these women had been sexually assaulted in their lifetime, and more than half of them had been sexually assaulted more than once in their lifetime. Along with that, what we found were corresponding health issues such as suicidality. More than 42% of them had attempted suicide in their lifetime. High instances of alcohol misuse and opiate misuse. We are not battling an opiate epidemic. We are battling a trauma epidemic. And if we were to take away all the opiates, people would treat themselves with heroin, with methamphetamines, with alcohol. What it takes is research like the work that we are doing at the Urban Indian Health Institute. In my personal opinion, I believe our study is one of the very first ones that actually found the correct rates of sexual violence within our communities. There are stories of where our women sit around and we don't talk about how do we prevent our women from being raped. We talk about what do we do after they are raped. That is the conversation our communities are having. And yet this data for the very first time is coming out of a little organization that had no money, and we self-funded that project in order to bring those to light. And in fact, when we look at VAWA dollars, none of the VAWA dollars flow to organizations like the Seattle Indian Health Board because they go to the counties. And so we are not actually getting dollars to provide culturally attuned care to our women who are victims of sexual assault and domestic violence. And so that is one of the instances of how those dollars aren't reaching the urban Indian communities. In addition, we've been doing work on missing and murdered Indigenous women. We conducted the very first study on 71 cities across the United States, and we found high instances of missing and murdered Native women. And in fact, our communities have been calling for a study like this to be done. The Department of Justice and the FBI said that it couldn't be done, that it would take too much money. I did it with less than $20,000 that, again, self-funded out of our organization, and we created a groundbreaking study that is the very first of its kind. What I found, though, is I can't tell you the rate of missing and murdered Indigenous women, and that's because the police departments aren't collecting race and ethnicity. We found police departments that weren't collecting it at all, or if their police did not collect it, they automatically default you to white within their data systems. What's interesting about both of these studies is they were led by Indigenous students that we support here at the Seattle Indian Health Board and the Urban Indian Health Institute. We are building tribal health capacity by supporting students and doing this work unfunded. It is a necessary thing for public safety for us to continue to address these issues and its impact on health in our women and our communities. Thank you.
Thank you very much.